Cecilia Mukasa. I'm the president of the Rotary Club of Kampala. And today we are in Kapir in Ngora district, and this is the second day of our medical camp. So as Rotarians, we usually come together and have these medical camps, and usually it's to provide health services or for the members underserved members of the community to be able to access healthcare services. And some of the services that we have is maternal child health. We're trying to improve that. We're trying to prevent diseases. We provide the eye clinic, which helps with sight, and if you have eye diseases or if it's anything serious, then you get referral to the eye hospitals. We also look at testing for cancer, sickle cell cancer. We are looking at prostate cancer testing, cervical cancer screening. Then we also do have just the general checkups that people can get. And we have, under the maternal child health care, you have the immunization of the babies, the children. And we also just have sessions, clinic sessions, where the members of the community are made aware about healthcare and well-being. So that is what has brought us out here today for the last 2 days. Which common diseases have we discovered in Ngora? One of the main things that I have noticed is that the queue for the Benedictine Eye Hospital clinic has been really, really long. And I'll also have my colleague come in and share with us. Boniface.
Of urinary tract infections, and the other issues were dental. Yesterday we got quite a number of dental cases, and then also we have a number of women that actually are benefiting from the scanning services that we have here. I think almost all the mothers that came through here have challenges with their lower abdomens, and so they had to go through scanning. But also we've seen a number show up for breast scanning, meaning that they have a positive attitude towards cancer screening. But then also another area which we have also registered a bigger number is actually malaria. So we had procured over 1,000 malaria screening kits, but it got done, and we had to procure more. So this shows you that a number of malaria cases are here, because most times by the time the doctor is predicting we need to go for that test, it shows that you're what. But now the results, we shall be able to get them to see which actually turns positive. But then majority, and our drugs for malaria is actually, we had over 24,000 doses, but we see like over 2,000 right now is over, and because we had a donation from the district health office. So that means that nearly 2,000 cases of malaria we had there. So this medical camp is an annual thing that happens, organized by the Rotary Club of Kampala in collaboration with the Rotary Club of Ngora and other Rotary clubs and Rotaract clubs, with other institutions like Cavendish University, Soroti University, Day Biopharma, Kampala Pharmaceutical Industries, and many others. We have the Uganda Cancer Institute here. We have the Ministry of Health team here. We have Mary Stopes.
We have
Piston Medical Suppliers,
Christian Blind
Mission. You're seeing one of their
actually, the Christian Blind Mission
is the one that
supported the Benedictine Eye Hospital to come and provide the eye.
Exactly. And as we all know, eye services are quite expensive, and this is an opportunity for the common person who is not able to afford some of these services. They are able to receive them from here for free, and this is a thing that we have decided that we will be doing it annually, but also it helps us to understand this community better. What we are doing here is not only health, we are also empowering the community, we have what we call basic education and literacy enhancement program. Yesterday we had the children. We took them through aspects of education and literacy, and we have also been having a legal aid clinic where we are teaching them with aspects of law and land associated conflicts and how they can be resolved. And so we think that we are going to be here for a long time to provide all areas of focus that Rotary looks at. There are around 7 of them, and looking at maternal and child health, water and sanitation. Already we have collaborated with Ministry of Water and Environment, and there's already
we put in some water. Like last year when we came in,
there was
there was no water.
Yeah.
We actually had a scenario where a lady had come in and had given birth. She gave birth to the baby and she was supposed to be cleaned, and the problem was there was no water. So when we saw that, we realized this is something that we really have to take up as a priority. So we worked with Ministry of Water and made sure now we have running water here at
running water
clinic.
Kapir.
So basically, the way the Rotary Club of Kampala has looked at this is we have adopted Kapir as a village. So when you adopt a village, you come in, you try and see what the needs are there, and you address each one of them one by one, and most of them are kind of correlated to our 7 areas of focus in Rotary, which, like he had started, was maternal child health, sanitation, disease prevention, peace and conflict resolution, there's basic education and literacy, and then you have economic development, and then there's also the environment, where we're trying to go green and keep the environment clean. So those are the things that we have set out to do, and we will do them slowly in collaboration with the community. So it means we're not here just for a short time, we'll be here for a long time. And we feel when we do put in that effort for that long period of time, it enables us to make sure that the community has really bought into what we're trying to get them to embrace. And when we leave, it's more sustainable, and then we are also able to measure the long-term impact of adopting a village. So that is what brought us here.
Todo ngelo jango kala chunus na da kina ungalu na da bu apone referring on leja doctor atol lo bu pedo anya na lo kaitna balance wanjo be eri no review kon raja ni Soroti hospital ni pero kene beraka ngat na da esi sara anya na pupi ngola bone tengo bala kada mama ngado minta na rejeka da ka bike ine ke wanta kanga mo so da scanning ye pu ngano scanning na jina do zone 2 hours left ke polo santo ngoni mamudono pedo kanya jina ngo kanga na da tere kwana itabu wadi kata ilo ai ngara kinenga alosa kwanya nara mukenka raina yanga ikawojau is more than a year so itamuto ngona kuba kwa yaita pero la ngara
ala muta ngata paka dule muta ngamukian ne gaile puyu muko kono do da mukian ngisira uta ngamukian ai wane cancer au gas ai lema ga tela ngamukian ko ko en waktu ko ka ko yo ade kana ko yo sera mukian malaria ke diku es lo que bogole te ka nyonga jokuka ni lo se tuka mukian jok jasimu ko ko le dunke chaira ki ko ke mo mi bo de paga ate ke ponen te ja una mukian na pona lo pota ja un to mukian ja en wa ke casa la odes ja en wa ke lo kama cha kwa de kasine kere na itu de yedi la chakini ko kawanya na ya alama